Facts are still important. I know we're arguing about science and just about everything, but if you've made the apocalyptic biblical 18-month journey of weirdness with us, you know that at the start of this absurd loneliness and disease and calamity that has engrossed and engulfed our country and others, Celine Gounder was here. Dr. Celine Gounder was here, scared and crying about what was happening or what might happen to our hospital system. And in the middle of that craziness, we were actually doing 15-minute segments of how to wash your hands, talking to people about how to wash your hands. And so here we are all these months later, and I fear this conversation a little bit because she's the host of The Epidemic and the American Diagnosis podcast, and she's also part of, or was part of, is still part of the Biden-Harris Transition COVID-19 Advisory Board. And I am afraid to ask you where we are as I see numbers that Florida and Mississippi and Louisiana are as bad or worse as Belarus and the Republic of Georgia. So I say all of that by way of introduction. Doctor, thank you for being with us. Please, can you give us something that feels good? Is there anything that feels good here? Because I'm scared again, scared the way I was when you first joined us.
Yeah, no, and it's great to be here. I'm glad everyone here is still with us. It has been a really tough 18 plus months going through this at the hospital and in the public health world. I think the good news is that this is in our control. It is in our control how the coming months play out. But will we do what's necessary to really squash this thing? We have failed on that over and over and over again. So what do the coming months look like if nothing changes right now? Well, we are still looking at a Delta variant related peak. So the Delta variant is this new, more infectious, more transmissible variant that arose first in India and then spread here early in the summer. A lot of the cases that we're seeing right now, hospitalizations, deaths, are being driven by and large by the Delta variant. It's almost all of them. And we are still seeing quite a lot of cases in the South. We are probably going to see a bit more of a prolongation of that because you are going to see kids going back to school, some people going back to the office. So we don't really expect that surge to peak and then come back down until probably October. And then similar to what we saw last year, and this just relates to holidays and family and friends hanging out together, and we tend to trust our family and friends. We may not ask them if they're vaccinated because we feel uncomfortable doing so. We may not want to mask around them. We want to just be normal around them, right? Well, unfortunately, that also leads to transmission of COVID. And just like last year, we saw this three-humped peak or surge over Thanksgiving, Christmas, and New Year's. I don't think it'll be as bad this year because a lot of people are vaccinated now, but we will have a similar kind of surge. And then I think we'll finally start to see things get a bit better in spring of 2022. Some of what really remains to be seen is how many more people are going to be vaccinated. We are nowhere near where we need to be in terms of vaccination rates. And I think people really need to understand that. This is such an infectious virus. You really need to be vaccinating a lot more people. The FDA approval of the vaccine is paving the way for a lot of employers to mandate vaccination. They feel like it gives them legal cover to do so. Some employers are already requiring it, but I think a lot more will start to do so with the FDA approval. And then we'll see, will that really bump up our vaccination rates? So what is in our control? Getting vaccinated, encouraging our family and our friends to get vaccinated, and then continuing with all the other things that we know work. Right now, we're still in a phase where we need to be layering those protections so that it's things like masking. Masking really does work. I would up our game on masking to what we call a KN95. It's better than a cloth mask or a surgical mask, but it's not quite to the level of what I might wear in the hospital, those N95s. But that bumping up the grade of mask will certainly help. And then doing things like improving ventilation, opening doors and windows as much as possible when the weather allows, improving air filtration. And there are cheap solutions to do that in the home. And then finally, when you're able to, socializing outdoors as much as possible.
Let's talk about things that may or may not be in our control, which is mask mandates and school boards having to defy the governors about installing mask mandates. How do you feel about that? Like here in Florida with Governor DeSantis trying to not have mask mandates in our schools.
I mean, to me, this is really tragic that such a basic, effective, and cheap public health intervention to prevent transmission has been politicized in this way. I compare it to politicizing toilet paper. It would be like saying, I'm a Democrat, I use toilet paper, I'm a Republican, I don't. And it just doesn't make any sense at all that we've gotten to this place. I think what you're seeing, and the Kaiser Family Foundation actually did a survey of children and how they felt about wearing masks. The kids don't care. It's the parents that care, the parents who are opposed to this. And I think it's because they view it as somehow branding their child with Democrat or liberal on their face by wearing that mask. And I really don't know at this stage how to break through that hyper politicization, polarization of what is, frankly, again, just like toilet paper, a super basic public health intervention that everybody should want to make use of.
But is there like a variable like kids with autism or kids with asthma that might go into them not having them wear a mask in school?
There are some kids who have perhaps behavioral issues where they may just really be resistant. But in terms of things like asthma, there is no evidence that wearing a mask is harmful. I can tell you I have a niece who's 2 years old, and she is totally fine wearing a mask. In fact, now she thinks it's weird if she goes to school without a mask. It's sort of like the accessory that they all wear. And so I think it's really much more about the parents than it is about the kids.
Doctor, what do you find most appalling about what you're watching as someone who's been warning us for a while that the hospitals are going to reach a breaking point?
Well, I did a focus group earlier this year with Frank Luntz, who's a Republican pollster, and it was with a number of young women. The point of that that focus group was really to find out what were their concerns with respect to vaccines and fertility, pregnancy, breastfeeding. And it was sort of odd because they kept saying they needed more information, but then had no questions for us about those issues or really anything. We kicked off that conversation also just talking about why each of us got vaccinated. It was me and two other public health officials, and I described what it was like walking across New York City to Bellevue, walking by the medical examiner's office, which is right across the street from Bellevue Hospital. And at the time we had multiple mortuary trucks parked outside. We saw nurses we worked with being intubated in front of us on the hospital wards, being taken off to the ICU. And in sharing that story, I was shocked that these women just shrugged their shoulders and said, well, we don't work in a hospital. We don't care. And that coldness, that not caring about the suffering of other Americans, about the very people who also, by the way, have been slaving away the last 18 plus months to help people, that I found profoundly disturbing, really shocking. And so when we're in the middle of this surge and you're seeing people like that in hospitals, I was just seeing a report this morning of a emergency room that has 20 plus people waiting for ICU beds in an emergency room, which guaranteed means some of them are going to die. The fact that some people just have this shrug of, well, I'm not in the hospital, I don't care.
I can't imagine that if I had gone to you when you were originally fearing and crying here and scaring all of us and said, we're going to get a vaccine, we're just not going to use it right. You couldn't have imagined that. You couldn't have imagined that there is an antidote for what it is that we're talking about and that we have it and America's got it, a surplus of it, and that we still can't get this right. I can't imagine how insane that makes you.
It's very frustrating, especially when people in other parts of the world, both my parents were immigrants. Access in India, for example, where my father was from, is really still very low. In other parts of the world, I spent a lot of time working in much of sub-Saharan Africa. They don't have access to vaccines. And here we are with that privilege, and we don't want to make use of it. I find that really very frustrating, very confounding. And again, it is in our power to turn this around, to change the situation, to get back to a more normal life if we take these steps. But we as a country, as a people, have refused to do so.
What do you say to people who say they have concerns about getting the vaccine because they're concerned about what it could do to your health later on down the road?
Well, one reference I would turn them to is my podcast, because we go through some of that science. So it's Epidemic. It's on Apple, Google, Spotify, all the usual suspects. But that said, these are vaccines that have been administered in hundreds of millions of doses to date. Over 4 billion doses of vaccine have been given around the world. Over several hundred million have been given here in the United States. We have yet to see any significant safety signal. And in the history of all vaccines, going back to the smallpox vaccine, if you're going to have a side effect with a vaccine, it happens within 2 months of vaccination. We are well outside of that. We have much more follow-up data than that. And so we can say, in terms of safety, these vaccines are very safe. They're also highly effective. And while there are some concerns about, well, are we seeing more breakthrough infections? With respect to hospitalization, the CDC, for example, released data, a couple papers earlier this week. Data from New York State shows that our protection against hospitalization, if you've been vaccinated, is still 95%. That's as good as vaccines get. And, we vaccinate to save lives, and the vaccines are quite powerful in terms of saving lives.
Celine, I don't know if I even want to hear the answer to this question, but I feel like a lot of vaccinated people started to live some semblance of a normal life before the Delta variant happened. And now we're kind of beginning to become more cautious. And some people are going to weddings and concerts and things like that. And I'm wondering what you personally would feel comfortable doing with, or what you would advise people to do in terms of indoor gatherings now if you're vaccinated.
Yeah, so those pictures of Lollapalooza really had me very worried. I think outdoors in general is pretty safe, but when you're talking about packing people, so close together for a concert or for a sports event, that is not safe. And so there you really do want to be layering other things, making sure people are vaccinated to attend such an event, that they are still wearing masks. In terms of indoor stuff, my husband and I still eat outdoors when we go out to eat. We don't have friends over. If we're going to socialize with friends, we do it outside. And even in a group of people who's fully vaccinated, if you are going to be indoors, at least at this stage, if they're not in your household bubble, I would recommend wearing a mask and opening those doors and windows.
What's your advice in terms of the booster shot, and when should we be considering a booster shot?
Yeah, I do want to be careful with the terminology booster, because I think for a lot of people that makes them think of the flu shot, which we do give yearly. And that's because the flu mutates very differently from COVID. And so you do need a yearly shot for the flu. With coronavirus, we think we're looking at probably a 3-dose regimen. Now, if you think about all the other vaccines we give, polio, tetanus, et cetera, most of those are actually 3 or 4 dose regimens. And so what we're thinking where we'll net out with COVID is we'll probably have a 3-dose regimen, but not yearly shots. Now, in terms of do we need a 3rd dose now, there are a couple groups where that evidence is very clear. So people who are highly immunocompromised, so people who have had a solid organ transplant, people who have AIDS, people who are on certain medications for the treatment of cancer or autoimmune disease. Those are people who don't have a response to the first 2 doses of vaccine. And to be clear, they may not even have a response to the 3rd dose, but it is worth giving them a 3rd dose to give them an extra shot at immunity. But at the same time, that group really does need to keep masking and using the other tools like ventilation and air filtration and so on as much as possible. And same applies to people who are around them. The other groups where there's good data for giving extra doses would be people who live in nursing homes. That's the one group where we have seen breakthrough infections turn bad, so to speak. So in other words, it's not just that they have some symptoms of COVID, but that they get really sick. So they end up in the hospital, they end up dying. So nursing home residents, it does make sense to give an additional dose. Although I would say most of those outbreaks in nursing homes have been triggered by caregivers who were not vaccinated, who brought virus into the nursing home from the community. And honestly, vaccinating those caregivers will have an even bigger impact on reducing the risk in nursing homes than would giving an extra dose to the nursing home residents.
Aside,
and then sorry, go ahead.
Aside from the the mistakes that we made during the initial rollout, what can we do to prevent them in this new rollout here?
With respect to vaccines?
Yes.
Yeah, I have a lot of reservations about the way the news of additional doses was announced this week. Basically, that was triggered by some leaks to the media, and then they had to move forward with making this announcement. But it has not gone through the normal regulatory process of the FDA reviewing this, the ACIP, which is this advisory board to the CDC, where they review all the data on vaccines before making recommendations. That process has not unfolded yet. And so to be announcing that, oh yeah, we're going to move forward with extra doses in late September is really premature. And it's really unclear that there's evidence to support doing that for everyone. I think it's really just very select groups like the ones I outlined where there's good data to support doing that right now.
You're very gentle. You are fact-based. You're not calling anyone dumb. I would imagine that a lot of what you're seeing play out in front of you, beyond being cold and cruel, is also beyond selfish, ignorant, and you're not saying any of that.
I think one thing I've learned over time, and I've worked with a lot of different infectious diseases and different epidemics. So started my career working in HIV and tuberculosis. I was an Ebola aid worker in West Africa. When people have beliefs, it may not be scientific, but there is a logic to them. And I think it's really important to understand that logic, not to be condescending, to really hear people out and try to understand where they're coming from. Now, you may not always agree, you may not always be able to convince them, but I think that's where the conversation needs to start. I think if you start with calling people stupid, condescending to them, I think the conversation's already over. You've already lost any opportunity to change minds.
What would be a good reason to not get the vaccine? Is there one
other than the ones that you've enumerated?
There's really no good medical reason not to get vaccinated. We had originally seen some very rare allergic reactions with the first dose of vaccine. This was now studied. Are there ways to pre-medicate people with medications like Benadryl, for example, which is over-the-counter allergy medicine, and just very simple things like that have been proven effective in heading off any further allergic reactions with additional doses. We've also looked at vaccines in pregnant women who are trying to get pregnant, who are breastfeeding. The vaccines are very safe in that population as well. And in fact, if a woman who is pregnant gets COVID, that can be extremely deadly, both to her and to her baby. Pregnant women are at increased risk for severe complications of COVID from the flu. They're more likely to end up in the ICU. So they certainly should be vaccinated. So really, from a medical perspective, there is no group that should be excluded from vaccination.
Where are we right now? What do you expect months from now? What is your level of, you're being very reasonable here. You're not emotional. There was a lot of unknown the first time we talked to you about this, and now you have some science and there is less unknown. What do you imagine is going to be happening here over the next 3 months? And how apocalyptic is this going to be if we continue to ignore you?
I think it's all going to depend on what we decide to do. I really hope that the FDA approval of the vaccines will translate into more people getting vaccinated. That'll probably be because employers mandate the vaccine, and so people have to get vaccinated for their job. I hope that has a big impact on vaccination rates. I have a hard time seeing people doing some of the other things I'm talking about, masking and then, using ventilation and so on at the levels that we really need to be. The America Rescue Plan from the Biden administration provided funding for things like upgrading ventilation systems, HVAC systems in schools. But the schools right now are so overwhelmed, and it's not just with COVID. They're dealing with discussions around critical race theory, around how do you handle issues around transgender students. I mean, they are in this political firestorm on multiple fronts. And so even if there's money on the table to do things like upgrading HVAC systems, they don't have the time to figure out, okay, what do we need to do? Who do we need to contract with? Get the job done. And, again, that's something that could have a big impact. So I'm a little bit skeptical that we'll be able to turn this around until early, 2022, because I just don't think we're going to use all of the tools at our disposal.
Doctor, thank you as always for the information. We appreciate your time. A weird question, just because I don't understand it. Someone asked me it the other day and I had no idea. If you have two parents who have tested positive and are asymptomatic, is it then hereditary to the children that if they have not gotten it, they won't get it because their parents are asymptomatic?
No, you can't make that leap. So if both parents have the infection, they don't have symptoms, the kids certainly should be tested. If they're negative, they should be kept away from the parents until the parents are negative. It's hard to predict how different people's immune responses will react, even if they're in the same family, even if they're the children of these adults who had no symptoms. We just can't make that leap.
What have you learned that you find the most fascinating just in the science and study of this over the last 18 months?
Yeah, one thing that's really interesting, and I think we need to be talking about more, is that vaccines work really well for inducing immune responses in your bloodstream, in your internal organs. Injectable vaccines don't work as well in what we call mucosal surfaces. That's like your mouth, your throat, your nose. And I think something that'll be talked about more is, should we be combining different vaccine technologies? So let's say you get one dose of an injected, you get one dose of an inhaled intranasal vaccine, so that you're optimizing different branches of the immune system. I think that's a really interesting question, and one that we still don't have an answer to.
Doctor, thank you as always for the information.
My pleasure.
Thank you.